Welcome back to the channel. I want to start today's video by addressing one of the most frustrating, confusing, and overwhelming parts of living with inflammatory bowel disease: the food. Almost every single week in my clinic, a patient will still sit across from me and ask, "Doctor, what should I actually be eating?" If you have Crohn's or colitis, what you eat may affect your symptoms, but it is different for everybody. There's no particular diet that works for everyone with Crohn's or colitis. What works for you, one person, might not work for another. Hello, I'm Dr. Kapil Dhingra. I'm a consultant gastroenterologist. Today, we are going to do a deep dive into the realities of food digestion and IBD. We're going to look at why food affects you, the myths surrounding fad diets, how to manage your nutrition during a severe flare up, and how to identify your personal trigger foods without ruining your relationship with eating. By the end of this video, you will have clear scientific roadmap for your diet. Let's get into it. So, how IBD actually affects digestion? To understand why food affects you the way it does, we first need to look at what is happening inside your body. Your gut breaks down food so your body can get energy and nutrients from it. Crohn's can cause inflammation or patchy ulcers anywhere from your mouth to your bottom. Colitis causes inflammation in your large bowel. Where that inflammation is located completely changes how your body handles food. If your small bowel is inflamed, you might not absorb nutrients or liquids as well as usual. If your large bowel is inflamed, you're likely to absorb most nutrients, but you might not absorb enough liquid from your food or drink. This is exactly why you might experience weight loss, extreme fatigue, or simply not feeling like eating much. It's not just in your head, your digestive engine is temporarily struggling to do its job. Did food cause my IBD? Patients carry a lot of guilt. They often ask me if something they ate over the years caused their condition. Let me be very clear, there is no evidence that any particular food causes Crohn's or colitis. We think it's a combination of your genes, your immune system, changes in your gut bacteria, and an external trigger. However, we are learning more about the modern diet. We know that ultra processed foods might increase the risk of developing Crohn's. These includes shop bought cakes, ready meals, sausages, and factory made bread. On the flip side, a diet that is high in omega 3 fatty acids, fruits, and vegetables might lower your risk. But what about curing the disease? There's no evidence that following a particular diet can cure Crohn's or colitis. Diets that claim to cure these conditions often restrict particular foods, meaning you may miss out on important nutrients if you follow them for a long time. And experts do not recommend completely cutting out particular food or food groups from your diet. Your overall goal should be to try and eat a healthy, balanced diet that gives you all the nutrients you need to stay well. Now, what about identifying triggers and the fiber myth? One of the most common fears my patients have is eating fiber. Fiber is a carbohydrate found in plants that help keeps your bowels working by softening and bulking up your poo. Because of the fear of triggering a flare, most people with Crohn's or colitis have a low intake of fiber. But here is what the current medical guidelines say. Unless you have a narrowing in your gut, which we call a stricture, there is no need to limit your fiber intake when your condition is under control. If you have a stricture, the advice changes. You may be advised to avoid foods that could block your gut, like the skins, seeds, or stalks of fruits and vegetables. Nuts, tough or gusty meat. So, how do you know what to avoid? Changes in symptoms after eating may not mean the disease is active. Food can trigger symptoms in people without IBD too. Instead of guessing, try using a food diary. Try to note everything you eat and drink to help identify possible trigger food. But it is generally easier to do this when your condition is under control and you're not in a flare up. The fad diets, what actually works? If you have spent any time on the internet, you have probably read about specific diets. Let's talk a few of them. First, the low FODMAP diet. This diet cuts out carbohydrates that are hard to digest, which can cause diarrhea, bloating, and wind. This diet might be helpful for people with Crohn's or colitis that is under control or only mildly active, but who still have tummy symptoms. However, it is not designed to be followed long term, and you should do it with supervision and support from a trained dietitian. What about dairy? Lactose is a sugar found in dairy products. Around 8 in every 100 people in the UK are lactose intolerant. The trap here is that symptoms of lactose intolerance may be similar to flare ups. So it's important to talk to your IBD team before just cutting out lactose. Then there's a medical diet we prescribe called exclusive enteral nutrition, which is liquid only diet. It works as well as steroids at getting Crohn's under control for children. It takes about 6 to 8 weeks for it to heal the lining of the gut. In adults, it is sometimes used if you have a severe flare up or you're having a surgery. Now, what about deficiencies in the silent symptoms? Even if you eat perfectly, your gut might not be absorbing what it needs. Around 1 in 3 people with Crohn's or colitis have low iron levels, which can lead to anemia. You might need iron supplements, and if you get bad side effects from tablets, you might have an iron infusion through a drip into a vein. Calcium and vitamin D are also incredibly important, especially since taking steroids makes it harder for your body to absorb calcium. These deficiencies often present as fatigue. Many people experience fatigue, which is extreme tiredness that does not go away when you rest. Not having enough energy or nutrients in your diet is one of the things that can cause this fatigue. To manage this, during times when you have more energy, you could batch cook meals so you have food ready for the days when your energy levels crash. Flare up tactics in social eating. So, what you should actually do when you are in the middle of a flare up and eating feels impossible. When you are in a flare up, you might not feel like eating much, but it is still important to get enough energy and nutrients. Try eating smaller meals, but have them more frequently to keep your overall food intake. Meshing on puring foods can make them easier to keep down. Try to include healthy fats in your diet like avocados, olive oil, or smooth nut butters, as these are high in energy. If you're losing a lot of fluid through diarrhea, it is important to make sure you drink plenty of fluids to avoid dehydration. Your team may advise you to use an oral rehydration solution, which is designed to have the right balance of sugar and salt to reduce your fluid losses. Finally, do not let this disease steal your social life. Up to 1 in 4 people with Crohn's or colitis say they avoid eating out because it is hard to control what food they are eating. It is absolutely okay to ask about ingredients or how things are cooked when you are at a restaurant. Managing food with IBD is a journey. Always speak to your GP, your IBD team, or dietitian before making a big changes to your diet. If you're struggling and feeling overwhelmed, please know that support is out there. Crohn's and Colitis UK has a confidential helpline that offers information and support for anyone affected. If you found this guide helpful, please subscribe to the channel for more honest and consultant level advice on navigating your gut health. Let me know in the comments below what is your biggest dietary struggle with IBD right now. I'll see you in the next video. Thank you.